before you marry that man, ask him what his blood type is. Because if you're negative and he's positive, I'm just warning you. They will be...
So yes, anti-D injections in pregnancy are very important if your blood group is Rhesus-negative. Your body can sometimes be trying to protect you, but that protection can put your baby at risk. But there is an easy way we prevent it. And let me explain how anti-D works in pregnancy. So you either are or you aren't Rhesus positive. That's a protein that can live on the surface of the red blood cells called the Rhesus antigen, or RHD. If you've got this Rhesus antigen, you're Rhesus positive. If you don't have it, you're Rhesus negative. So then, if you're Rhesus negative, but your partner is Rhesus positive, it may mean that your baby could be Rhesus positive. Now, your Rhesus negative immune system might see your baby's blood cells as foreign, like an invader, and it might try to make some antibodies that destroy your baby's blood cells. Now, this doesn't usually affect your first pregnancy, and that's because your body doesn't always develop these antibodies right away. But if there is a time when fetal blood from your baby mixes with your blood, which can happen either at the time of birth or any other time you've got some bleeding, like if you have a miscarriage or if you go through some trauma or if you have a certain procedure, you may become sensitized. So then in the next pregnancy, that's when the problems can begin. So if your next baby is also Rhesus positive, your immune system can remember and then attack your baby's red blood cells. That can lead to Rhesus disease, also known as Haemolytic disease of the fetus and newborn. And this can cause anemia or jaundice or more serious complications in your baby. And that is why we give anti-D. Anti-D immunoglobulin is an injection that prevents your body from making those antibodies in the first place. It's usually given at around 28 weeks of pregnancy and then again after birth if your baby is Rhesus positive. You might also be offered it earlier if you are having some bleeding or you undergo a certain procedure. And according to UK guidelines from the British Society of Haematology, this approach has massively reduced Rhesus disease and it makes pregnancy safer for thousands of families every year. So if you are Rhesus negative, let us know, how do those injections feel for you?